Stop recording button.
Well, hey guys, hope everybody is staying healthy and having as much enjoyment as you can right now through these crazy times and still feeling like you can do the things that are important to you. So I'm here today, and you're probably wondering what you can do and how you can screen yourself for the coronavirus. You're probably feeling a little bit paranoid, and you don't quite want to see a doctor yet, but you also don't want to just kind of sit back and do nothing. You might be having symptoms. Maybe there's a little phlegm in your lungs. Maybe you just kind of want to be sure on every level. Apple and CDC have created an app because Apple's very connected and is moving healthcare forward in a lot of different ways and even influences. We've seen a real shift in video doctor visits, for example. I've tracked data and had kind of a good time sending it to doctors, and they've always appreciated it. It seems like it makes your visits easier sometimes. I haven't had to do it with every doctor visit, but it is nice when you can. And so I'm going to get onto the COVID-19 apps page on their screen here, because we can screen ourselves now for symptoms of coronavirus. I'm using a program too. You'll hear my phone talking, called VoiceOver. And what it is, it's a program for if you're blind, any Apple device you have will talk, and Android devices has it too. It's called TalkBack. But with Apple, if you are curious about what VoiceOver is, or if you just want to, you don't want to use your eyes as much, maybe you have some vision loss, or you're just kind of curious as what it is, all you have to do is pick up your iDevice, whether it's an iPhone, an iPad, and you just tell Siri to turn VoiceOver on, and then it will tell you what VoiceOver is, and you can kind of have your phone talk to you and show it off, if you think it's that cool, which it really is, because it's changed the way technology works. But anyway, I'm really curious to explore the COVID-19 app as much as you probably need to know how it's going to work for you if you think you might have symptoms of coronavirus. So I'm going to hit the home button to get into the app.
Selected screen recording button. Selected screen recording button. COVID-19 logo Apple image.
So now it shows the Apple logo at the top of COVID-19, and if I swipe to the right,
logo CDC.
It's going to show the CDC logo, because they both designed this app in partnership together. So
COVID-19 screening tool.
Right,
Heading.
COVID-19 screening tool.
This tool can help you understand what to do next.
Okay, so
Let's all look out for each other by
tool, okay.
COVID-19.
So this is going to tell me a bunch of information on the screen here, if you guys can see it. But I'm going to let VoiceOver read to us, so you can see how that works as well by just doing a 2-finger swipe down. And if you have sight, you can read along.
COVID-19 screening tool. Heading. This tool can help you understand what to do next. Let's all look out for each other by knowing our status, trying not to infect others, and reserving care for those in need. Start screening button. More information. Heading. About COVID-19, an up-to-date rundown of the virus and its symptoms button. What you can do. Information about social distancing, isolating from others, and more button. COVID-19 testing. Current guidance on who should be tested and what to expect from test results button. Updates from Apple News. Fact-checked resources on the coronavirus button. Our commitment to privacy. Heading. Apple is not collecting your answers from the screening tool. To help improve the app, Apple collects some information about how you use it. The information collected will not personally identify you. Developed with. Heading. CDC button. The White House button. FEMA button. This app was developed in partnership with the Centers for Disease Control and Prevention, CDC. It is not meant as an endorsement of any Apple products. Privacy policy button. Legal button.
Okay, so we know it's been developed with Apple, CDC, the White House, and FEMA. Okay. And it is also good to know that if you want to get news about the coronavirus, you can open up Apple News from here. And you can even choose your news sources.
More information.
For
Heading.
what news you trust. Okay. Sometimes voiceover will move on the screen a little bit, so it's just saying if you want more information. So you can hit any of these buttons if you want a little more info about that. But in order to start the screening, we're going to
Start screening
swipe
button.
back, and there's the start screening button. I just swiped to the left to get to that button. I'm going to double tap to open it now,
Image.
and there's some kind of image, but that's irrelevant. Let's swipe.
COVID-19 screening tool. List, number, image.
Okay, list a number image, which is probably just referring you that there's going to be some numbered questions, and there's some images here that we will swipe past.
You'll answer a few questions about symptoms, travel, and contact you've had with others.
Okay, so I get to answer questions about symptoms, travel, and
You'll answer a few
contact I've
questions.
had
Hand
with
raised.
others.
Fill.
So I'm
Image.
swiping to the right, and there's a hand raised image.
Your answers will not be shared with Apple or others without your permission. Checkmark, circle, fill, image. By using this tool, you agree to its terms and that Apple will not be liable for any harm relating to your use.
Okay, so I guess it's just showing you fill these in kind of thing.
Recommendations provided by this tool do not constitute medical advice and should not be used to diagnose or treat medical conditions.
Okay, so if you're still feeling, you obviously would go to the doctor if you're feeling bad enough, and that this isn't meant to just replace that, but maybe meant to just...
Recommendations provided by this tool do not constitute medical advice and should not be used to diagnose or treat medical conditions.
just be able to test kind of yourself.
See terms, button.
And,
Use for myself, button.
So I'm going to use this for myself here. Double tap to open.
Use for myself. Next question, dimmed, button.
Okay, so if I touch my 4 fingers to the top of the screen, it kind of took me to the bottom here, but if I touch 4 fingers to the top, it will get me to the top where I can start answering questions.
Screen recording in progress, button.
Okay.
I have at least one of these before you
Okay,
start.
so I had to swipe all the way to the left to get to the, for the half of this screen that's not recording, so I can read everything full. So I'm going to swipe to the right and kind of go through this.
If you are experiencing any of these before you start.
Okay, before you start.
If you are experiencing any of these symptoms, stop and call 911.
Okay.
Bullet constant chest pain or pressure, bullet extreme difficulty breathing, bullet severe, constant dizziness or lightheadedness, bullet slurred speech, bullet difficulty waking up.
Okay, so if you're experiencing these emergency symptoms,
Lines?
let's
Words.
in order to ensure you're paying attention to your own body, let's go through these symptoms one by one, and you can pause the video and make sure you're not that you're fully paying attention to your body and that you're not experiencing any of these, because it's not the easiest thing in the world when you don't want to see that you might have a symptom, that kind of thing. So let's
If you, lines, are experiencing any of these symptoms,
I'm going to go
stop
line
and
by
call
line. I
911.
do this by using the rotor to navigate, which is like a little imaginary dial that you'd place your fingers on the screen and turn, thumb and pointing finger to the right. I'm going a little bit line by line and word by word and such to read these carefully for you guys so you can, again, assess. Are you having chest pain? Maybe you're having chest pain, but you're not paying attention. You're trying to ignore it. So let's make sure that that's not the case before we get started here.
Bullet constant chest pain. Bullet constant chest pain. If you are experiencing any of these symptoms, stop and call 911. Words. If you are any of these, stop and call bullet.
Okay, so it's going to show some bullet points here.
Lines. Constant chest pain or pressure, bullet extreme difficulty breathing, bullet words, bullet
Constant
chest pain,
chest pain, if you're experiencing constant chest pain.
or pressure.
Or pressure, which, yeah, if you have like this congestion or pressure in your chest, that's definitely, if you kind of take a deep breath, you can kind of tell if you have that or not.
Extreme.
So, kind of breathe, make sure you don't have that. Okay.
Extreme difficulty breathing.
Extreme difficulty breathing, we don't want
Bullet.
that. Same sort of thing. So they're just saying if you feel that your chest is congested and you have extreme difficulty breathing that way, that's definitely another reason.
Severe. Constant. Dizziness.
Okay, severe constant dizziness, that's definitely not just an ear infection.
Or lightheadedness.
Or lightheadedness. If you have lightheadedness, it may not, try drinking some water, and if it doesn't go away,
Bullet.
maybe.
Slurred. Speech.
And
Bullet. Difficulty.
slurred speech.
Waking up.
Okay. Slurred speech, for whatever reason, or difficulty waking up. But obviously, yeah, if you have difficulty kind of waking up, then you might not be here watching this, but maybe you keep dozing off. So, if you don't have any of these symptoms, we could definitely continue on to test for any more. So let's swipe to the right.
I have at least one of these symptoms. Button.
Okay, you can tap if you have at least one of these symptoms.
I do not have any of these
I
symptoms.
do not
Button.
have any of these symptoms. Okay, I'm going to tap this, double tap.
Selected. I do not have any of these symptoms.
Okay, and it says selected to show that the button is selected.
Close. Button. Next question. Button.
Close. I can hit close or next question.
Next question. Dimmed. How old are you? How old are you?
Okay, how old are you? So I touched my pointer finger to kind of the top of the screen, and it says
Under
how old are
18
you?
button.
And so I can double tap on under 18 button.
Between 18 and 64.
Between 18
button.
and 64.
65 or older.
65
button.
or
Close.
older.
Button. 65. Between 18
And
and
I
64.
can always hit
button.
close to stop, or I swiped back a couple times to get to between 18 and 64.
Between 18 and 64. Button.
And I'm going to double tap.
Selected. Between 18 and 64.
Okay, it
65.
shows
Close.
that button is
Next question.
selected. I
Button.
love how they do that. Some apps and web pages don't do a very good job, but they show that it's clearly been selected. And now I swipe to the right a couple times and hit that next button. Double tap.
Next question. Dimmed.
And touching the top.
Are you experiencing any of these? Are you experiencing any of these symptoms?
The screen, I make sure I'm at the very top by swiping left to kind of, you hear that
Are you experiencing
sound,
any of these?
and it kind of shows you that you're at the top. You can hit the wall kind of thing is what I call it. But are you having any of these symptoms, it says. So I'm going to swipe to the right.
Select all that apply.
Select all that apply.
Fever, chills, or sweating. Button.
Fever, chills, or sweating button.
Difficulty breathing. Not
Difficulty
severe. Button.
breathing.
Difficulty breathing. Not severe.
Not
Button.
severe. Okay, that's just like maybe a mild congestion, I would imagine.
New or worsening cough. Button.
New or worsening cough.
Sore throat. Button.
Sore throat.
Aching throughout the body. Button.
Aching throughout the body.
Vomiting or diarrhea. Button.
Vomiting or diarrhea.
None of the above. Button.
None of the above, which would apply to me. Double tap.
Selected. Not close. But next question. Button.
And swiping to the right to get to that next question button, I'm going to double tap.
Next question. Dimmed.
Okay. Touching the top of the screen.
Do you have any of the, Do you have any of these conditions?
any of these conditions?
Select all that apply.
Select all that apply.
Asthma or chronic lung disease. Button.
Asthma, ear, chronic lung disease,
Pregnancy. Button. Diabetes with
pregnancy,
complications. Button.
diabetes with complications,
Diseases or conditions that make it harder to
diseases
cough.
or
Button.
conditions that make it harder to cough.
Kidney failure that needs dialysis. Button.
Kidney failure that needs dialysis. We know a lot of people in our community that have that.
Cirrhosis of the liver. Button.
Cirrhosis of the liver,
Weakened immune system. Button.
weakened immune system,
Congestive heart failure. Button.
congestive heart failure. Yep, know that too.
Extreme obesity. Button.
Extreme obesity.
None of the above. Button.
None of the above.
Selected.
Double tap.
None of the above.
And
Close. Button. Next question.
next.
Button. Next question. Dimmed.
And we're gonna go to.
In the last 14 days, have you traveled internationally?
Okay, this is the top of the screen.
In the last,
In the
14,
last
days,
14 days,
have you traveled internationally?
Have you traveled internationally? So we're gonna swipe.
I have traveled internationally. Button. I have not traveled internationally.
I
Button.
have not.
Selected. Close. Next question. Button. Next question. Dimmed. Screen recording in
Okay.
progress. Button. In the last 14
And we're
in the last
gonna-
14 days, have you been in an area where COVID-19 is widespread?
Have you been in an area where COVID-19 is widespread in the last 14 days?
Select all that apply. I live in an
Select
area
all
where
that
COVID-19
apply.
is widespread. Button. I have visited an area where COVID-19 is widespread. Button.
I live in an area where COVID-19 is widespread. I visited an area where COVID-19 is spread, or
I don't know. Button.
I don't
None of the above.
know,
Button.
or just none of the above, which I will
Selected. None of the
open
close.
that,
Next
and we're
question.
gonna hit
Button.
next
Next question.
question.
Dimmed. In the last 14
Okay,
days,
in the
what is
last
your exposure to
14
others who are known to have
days.
COVID-19?
What is your exposure to those who are known to have COVID-19?
Select all that apply.
Select all
I live
that
with someone who
apply.
has COVID-19. Button.
I live with someone that has COVID-19.
I've had close contact with someone who has COVID-19 for 10 minutes. I was within 6 feet of someone who's sick or exposed to a cough or sneeze. Button.
Okay. For 10 minutes, I've been exposed to someone who's coughed or sneezed.
I've been near someone who has COVID-19. I was
I've
at least
been-
6 feet away and was not exposed to a sneeze or cough. Button.
Okay, so, or you've been near someone.
I've had no exposure. I have not been in contact with someone who's sick. Button.
Okay, I'm going to double tap this.
Selected. Close. Next question. Button.
Next.
Submit. Dimmed.
Okay,
Do you live
and
or
one
work in a
more
care facility?
screen. It shows the submit button because it kind of takes you to the bottom to kind of show what's expected next, what you can expect on the screen, that is. So I'm
Do you
swiping.
live or work in a care facility?
I'm on the very top of the screen, and it asks, do you live?
Do you live or work in a care facility? This includes a hospital, emergency room, other medical setting, or long-term facility. I live in a long-term care facility. I live in a long-term care facility. This includes nursing homes or assisted living. Button. I have worked in a hospital or other care facility in the past 14 days. This includes volunteering. Button. I plan to work in a hospital or other care facility in the next 14 days. This includes no. I plan to work in a hospital or other care facility in the next 14 days. This includes volunteering. Button. No. I don't live or work in a care facility. Button. Close. Button. No.
Okay, so
I
I
don't
can
live or
hit
work in a care
no.
facility. Button. Selected. No. I don't live or work in a care facility. Close. Submit. Button.
And I can hit submit, and we'll see what happens.
Done.
Okay.
Image.
And
Image.
it shows the done,
Done. Button.
image.
Logo app. Logo CD. Done. Button. Image. You should practice social distancing.
Okay, you should practice social distancing.
Help stop the spread. When outside the home, stay at least. You
Okay,
should practice social.
so it looks like there's a lot of info. I'm going to do a 2-finger swipe down to read here.
You should practice social distancing. Help stop the spread. When outside the home, stay at least 6 feet away from other people. Avoid groups. And only use public transit if necessary. Your next step. 1. Circle. Fill. Image. Maintain social distance. Small but important steps can slow the spread of COVID-19. Avoid groups of people and keep 6 feet apart from anyone who's not part of the household. Especially avoid those showing symptoms. Smart. Circle. Image. No test at this time. As of now, your answers suggest you do not need to get tested. If anything changes, take the questionnaire again. Your responses. Thermometer. Image. You are not experiencing symptoms. Person. Crop. Circle. Image. You do not have relevant conditions. Location. Image. You have not traveled internationally. Globe. Image. You have not been to an area where it's widespread. Person. 2. Image. You have not been exposed to others who are sick. House. Image. You do not live or work in a care facility. Calendar. Image. Completed APR 1, 2020 at 12:07 p.m.
Okay, so
Logo Apple. Image. Logo CD.
with
Done.
that, I did a couple swipes from the top, and I'm done.
Done. Button.
Thank you guys
COVID-19.
for
Logo Apple. Logo CD. COVID-19. This tool can help you understand what to do.
Yep, and it takes me right back. So thank you guys. I'm back at this page if I ever have symptoms, or if you ever change and you get symptoms, it will start you back on this page again. So thank you guys
COVID-19 screening tool.
for
Screen recording in progress. Button. Status bar item.
exploring the COVID-19 app with me. I really do hope that everybody is staying healthy, washing hands, and social distancing, and still feeling connected with the technology that we do have. I'm definitely grateful for the technology, and I hope that, again, you guys can stay healthy and stay symptom free. So if you have any questions, feel free to leave them in the comments below, or definitely look at this app in the App Store. I will put the link in the description and show notes, and I'll see you guys next time. Take care, and remember, stay healthy.